Hi, my name's Kaitlin. I'm a mental health wellbeing practitioner working for the NHS in Greater Manchester. So I work with patients and their doctor's surgeries who are experiencing mental health difficulties, from anything from anxiety all the way up to psychosis, depending on what their issues are and what they want help with. So it's a very goals-based approach. Depending on what that person wants to work on, I'll guide them through that based on cognitive behavioural therapy interventions. So I've always been really interested by mental health, and this specific role, which was funded for training for a year and then being qualified, what is a really great opportunity for someone who's interested in mental health. And it means that I get to reach out to people who work in or who are in their GP surgeries, who need support from home, who might not be getting it otherwise. So it was a really good opportunity for me to develop in my career in mental health. So no day is the same as the next, but in general I see about 5 patients a day, each getting an hour session. So that's 5 days a week, 5 different patients. I'll see someone for a consultation first, which is just kind of to create goals and the problems that they want to work on. And then following from that, it'll be an hour session working on therapeutic intervention. When I'm not seeing patients, I'm doing referrals, I'm speaking to their family and carers or other health professionals to make sure that their wider life is okay as well. So I think that I'm in a really fortunate position. I get to work with patients who are experiencing difficulties with their mental health, but they're not receiving secondary care support, so they might just be missing out on that extra support they could get. So I help people who maybe wouldn't have got help before, because this is such a new role. And I've had people who feel like I've really helped them maybe reach their diagnosis that they hadn't gotten before, or with extra support that they wouldn't have gotten before. So I feel that I'm in quite a lucky position to be able to offer that to patients where they wouldn't have necessarily had it. So it's been a learning process for everyone involved because this is such a new role. However, straight at the beginning, I had meetings with the people in the primary care network, that's the managers, operations manager as well, and the clinical director, and they kind of got to know me, who I am, and how they could kind of integrate me into their workforce to see how it would benefit me as well as them. So I have been really fortunate that they have been really welcoming and open, and I have been really well supported by them.